Funding for Baltimore City Health Department and coming from Centers for Disease Control. We are so happy to have many of our ambassadors here. Ambassadors, please shout out that are partners in this effort to promote sexual health in Baltimore City. Come on. Yes, wonderful. And today, what's different is that my co-host, Delina, is actually going to be a guest. So she is going to be one guest speaker that I have here for this event today. And we have a fantastic guest speaker also. Up a bit.
Sure. Thank you so much, Rebecca. Again, as she said, I'm Delina Watkins. I am a nurse by profession. I'm the CEO, director, and founder of the Women's Wellness Lounge. We're located downtown on 415 North Howard Street. And we're a safe space for marginalized women to be safe, seen, and heard around all things that impacts their health across the lifespan. So it's my pleasure to be here tonight. And as she said, we'll be focusing on
and get everything that you need to make you feel so pampered and well. And for this, I'm going to let you introduce yourself a bit. Tell us about who you are.
Perfect. Thank you. Good evening, everyone. My name is Bernice DeRosa. I am a PhD candidate and also an infectious disease and addiction medicine nurse practitioner. My work focuses on sexual reproductive health disparities impacting Black women primarily. So my research focuses on strengthening systems to better care for our needs. Nice to meet you.
All right, everyone. So we've got really fantastic two nurse practitioners here to share with us information about protecting ourselves from all kinds of STDs and HIV and get down with a few questions myself. Okay, so Delina, so what are you doing under because you're one of our partners promoting sexual health. So what specifically are you doing around PrEP?
So I'm specifically working with, obviously providing education, wrapping around with resources and referrals to testing as it relates to sexual health and PrEP access. So we're not doing testing at the Wellness Lounge, but we are referring out to our partners for testing. But again, it's really just out there educating women primarily, because that's my target audience, around what sexual health and reproductive health looks like. And primarily PrEP. Again, I'm sure we'll cover this a little bit later, but not really understanding what PrEP is. I find that that's a huge thing. And so again, being able to meet them where they are and educate them at that level.
Wonderful. Okay, what is PrEP and why should we focus on Black women specifically when it comes to PrEP?
Sure. So what PrEP is a medication that is used before being exposed to or having HIV to prevent HIV. So there's an injectable or there's oral pills that you would take. You take those pills every single day, and the injectable, it's every 2 months with a 1 month lead-in. And the importance of PrEP is, patient controlled. So instead of relying on, like from a woman's standpoint, your partner wearing protection, this is something you can do yourself to make sure that you're protected from HIV It obviously does not cover STIs, but at least, when it comes to HIV, which has, complications, it's not a death sentence like it used to be, but there is complications and stigmas and things that come with it. So as much as we could prevent HIV, that's the goal here. So it's a tool, an empowerment tool, like I like to call it, in order to empower people, women especially, to prevent themselves from being HIV positive.
Okay, and we are empowering women.
Mhm.
Hello, it's Women's Month,
Oh, yeah.
right? Women's
Yeah,
History Month.
forgot to
Yes.
lead in with that.
Yeah, so
Women's Month.
apropos that we're having this conversation, so again with the focus on Black women, how are Black women disproportionately American women? Tell us a little bit about that.
Yeah, so globally, Black women are overrepresented in HIV infections. So when you think about South Africa and things of that nature, there's this in HIV numbers. So there's a lot of things that go into that, and I'm sure we'll unpack a little bit of that today. But despite us making up such a big number in HIV numbers every year, we're underrepresented in PrEP prescriptions. So when you look at who is on PrEP, it's mostly white gay men and other demographics of people, which if you think about it, that doesn't make sense. The people who have the most risk and the most vulnerability should be overrepresented. Yes, the math isn't mathing, as we would say. So this is why it's important. Who is perceived to be at for HIV. We always focus on like certain demographics, like gay men or men in prison and all these other things, which leaves us out of the conversation despite the numbers continuing to be what they are.
Okay, so it's like a secret that people do not know much about PrEP. How many of you have heard of PrEP before an interruption? Okay, so I see about 3 hands before you came in connection with us. Okay, so raise your hands again before you ever came connected. So there are only 4 people out of what, about 5 people out of 40, about 45 people that have heard about PrEP. So we've got a long way to go. We have a lot of education to do, and that is why we're doing it. Now, the responsibility after you hear this conversation and sexual health.
Well, I think what she was stating earlier about removing the stigma and changing the perception individuals get their what I call 30-second sound bites, it's going to be via commercials, right? Or something you hear on the radio. Typically, it's not those words, and the commercials that you see are not geared towards people that look like us. When we think about some of the commercials around PrEP, I don't see myself in those commercials. And so therefore, I'm not thinking to tune in to find out what it means uh, that you must be tested at least every 90 days. It doesn't matter if you're, in a heterosexual relationship, if you're using condoms or whatever. We have to make sure that they're empowered around the information and know that it's not something that a doctor has to recommend that they get. It can only be done with their annual physicals or their OBGYN. This is something that they have to understand that they are empowered around. And so I feel like PrEP, when I describe it, I tell them it's like putting your seatbelt on each and every time you get in a car. You don't put the seat with HIV. So it's again how we disseminate the information and how we, get into forums like this and normalize the conversation.
Okay, so PrEP is highly effective. So can you tell us a little bit about how then you do not have to worry about HIV. And so we not have to worry, then what is the rate of protection that people get from PrEP? And can you also say a little bit about PEP and share the difference between PrEP and PEP? How many of you have heard of PEP?
That's gonna be my next question.
Okay, one person.
I've heard of it.
Two, three. Three people have heard of PEP out of 45 or so that are present here.
Yeah, so starting with PEP. So PEP, like I said, PrEP is pre-exposure. So before you're exposed, you take it every day, other than the injectable. PEP is post-exposure, so similar to women who know about Plan B. So it's a medication you take within 72 hours of potential exposure. So let's say, a condom broke, or you're unsure of this person's status, or you've been exposed to some kind of like fluids or something where you're unsure about the situation, you could take this medication within 72 hours to prevent yourself from getting HIV. And this medication is a 28-day medication. And then I like to encourage people to have the conversation to see about continuing on as a PrEP regimen after you finish your PEP prescription. And then as far as like efficacy, how effective PrEP is, because we want to know, okay, if I'm taking something, does this work? How effective it is? So of course with medication, especially when we're thinking about oral medication, so pills, if you're taking it as prescribed, it is 99% like effective.
Did you hear that? 99%, almost for sure to protect yourself from
Exactly.
HIV.
But that comes with taking it as prescribed. There's wiggle room that you need to like talk to your provider about, but as women, and this medication is for men and women, we're just focusing on women because of like, they're usually left out of the conversation. But for, let's say, men, you need a shorter window period for PrEP to be effective in your system. But for women, in order for PrEP to be uptake in the vaginal tissue, you need 21 days of consistent use before you're fully protected. So prior to that 21 days, you should be using another method of protection to be fully protected as well.
Okay. So great. And then when you are using PrEP, you still need to use condom for STI protection. So what we're talking about PrEP and PEP is around HIV/AIDS prevention. So PEP also is like if we're out and you're feeling a little tipsy and the next morning you discover yourself next to someone, you're like, that has happened with lots of people. I'm glad you're laughing because it's a reality. Then PEP is also for you. Okay? PEP is also for rape cases. So if you've been raped, certainly you don't know the status of the person that you're with, and you will get on PEP. And so PrEP, even though we're talking about women, Black women and PrEP, but it's also for men as well. So there is the pill version that you take every single day, and then there's the injectables that you take twice a year. Okay. So some people prefer the injectables because then I don't have to take a pill every single day. I'm done. I'm good. Okay. So those are the options that you actually have available for you, and highly effective, 99%. And overall, PrEP fits under overall sexual health promotion. Okay. So we're not pushing the pill, right? PrEP as a pill. Okay. So give us a big picture when we think about sexual health. What is it? What does it include?
You're talking in general, right?
Yes,
Sexual
in general.
So
PrEP
in-
is a piece of it. Yeah.
Right. So PrEP is a piece of it, like you said, even though that's, primarily what we're focusing on. But when you think about sexual health, it's really understanding and knowing what you're at risk for. So sexual health, we always just think about the act of having sex or intercourse. But sexual health revolves around more than just that. To me, I always like to say that, sexual health really starts in your mindset, how you approach what that entails, what that looks like, and how can that impact you in the long term. So it's really understanding your approach, your view, and your understanding of what sexual exposure can look like, right? So STIs, we used to call them STDs back in the day. So STI, that they're, understanding what your risk is, understanding what to look for, understanding how to protect yourself, knowing that if you feel that there's a potential for exposure, where to go to get assistance, and not feeling like, once again, there's a stigma associated with that. Because remember, we all can potentially be exposed and not understand or realize, right? Because we're being empowered with wanting to protect ourselves. That doesn't mean that the act of doing it, that your partner is as well. So when I think about sexual health, I like to say just go beyond the physical and think about the impact on the emotional and mental as well.
All right. And talking about we empower women when we think about sexual overall, having the power to make decisions about our body, right? Having the power to make decisions about who we say yes to, having the power to abstain from sex, having the power to have a conversation with our partner to say, if we're going to have sex, then my expectation is we both first get tested for HIV and other STI. If we're going to be sexually active, we need to think about what contraceptives we're going to take and how we're going to take PrEP to reduce our risk, and also negotiate around condoms. Yes, men, condom, that's the only way to go. Put it on or no sex, okay? So having the power to negotiate around those things are absolutely very important. And determining when you're ready for sex. You're in charge of your body. You're in charge of your own decision. So those are some of the steps overall, the big picture about sexual health. Taking the responsibility on for yourself to make the right decisions, the informed decision. The decision is ultimately yours. When and how and where you're going to be and what you're going to be using. All we're trying to do is provide information so you can make informed decisions. Okay? So anything you want to add before we open it up for Q&A?
Yeah, thank you. And to your point, about empowerment, it's also important to understand not every person, and I speak in the lens of women, but I understand men are also impacted by intimate partner violence. But not everyone's empowered to make these decisions and to have that hey, we're wearing a condom or not, period, energy in their relationship. And that is another important role of PrEP. These conversations, these power differentials are challenging. And this is one other way that you can have a tool in your toolbox to protect yourself, regardless of what your partner is doing. If you can't ensure monogamy, if you can't ensure consistent condom usage, this is one thing. Of course, it's not going to protect you from STIs, but it's one thing that's going to protect you from something that's lifelong. So it's ways to kind of figure out where you're situated in the world and to kind of add tools to your toolbox that have the best outcomes that you can potentially.
That's beautiful. That in itself is empowerment, right? If you're in a situation where there is a level of domestic violence, but if you're taking PrEP, you don't have to reveal it. That you are in charge now of preventing HIV infection for yourself. Okay? All right, wonderful. Now we're gonna open up for audience question and answer. This is an opportunity for you to ask your questions, whatever they may be. Not specific, it doesn't have to be only about PrEP. One thing we did not talk about is actually HIV and STI screening. So if you can share, who would like to start, share information about the options that are available for HIV and STI, that would be awesome. And I think I'm hoping that it was announced that we have HIV and STI testing going on here until 7:30, and people know where that testing is taking place.
So right outside, there's a van. It's a white van on a corner. Anybody that wants to get tested, the white van is right out front.
It's Baltimore City Health Department. They're there until 7:30. It will not take long. So throughout the time between now and 7:30, please go for HIV and STI testing. So what are the options, the different options for HIV and STI testing?
So there's several options. I always encourage people, there's a lot of anxiety around testing. So there's free tests. If you don't want to tell your provider that you have a relationship with, that you're interested in testing, that's sometimes not the easier route for people. There's, especially in Baltimore City, there's testing on the vans. Baltimore City has a lot of initiative. There's Chase Brexton that has like drop-in options. There's so many community resources that has drop-in options. There's also a service called I Want the Kit, where you can order a kit to be delivered to your house and you do free testing that way. And there's you swab yourself, 3-site testing, and I'll explain that quickly in a second, and then you could do your HIV testing. The only thing with the at-home testing that I will say is that HIV testing does not come with in-person counseling unless you set that up. So of course, there's anxieties and things that may occur should your test be falsely positive or you're unable to read it. So you have to really do an assessment of yourself, like how would I react with this result? Would I need additional support, and make those decisions then? Because I would hate for anyone to not be supported in that time, whether negative or positive, to make proper decisions. That's going to be best for you. And then as far as other screenings, there's syphilis, gonorrhea, chlamydia, and ideally, not all places do this, but I encourage you should be getting 3-site testing. Gonorrhea and chlamydia in particular are site infections. So I know there's children here, so where you're engaging in sexual intercourse should be swabbed. So whether that's orally, rectally, vaginally, penile, you should be getting those sites tested. It's not enough to just pee in a cup. I know there's a lot of places that do that, but that is not efficient and effective comprehensive testing. You should be doing site testings and swabbing. Ideally, that's the best metric, but you do what you can, you navigate what you can with your insurance and where you need to go. I understand those challenges. Some testing's better than no testing. And there's several resources out in the communities.
Great, thank you. And there is also the rapid testing. So there are some people do not want to wait for the test results to come. But there's a sticky point about rapid testing.
The time frame.
So who wants to address it?
Her.
Yes, there's rapid testing, but with all STIs, not just HIV, there is a window period of when you should be getting tested. So if you went out last night and potentially was exposed, there's not a test that's going to be positive today. So there's a window period which varies per STI, so I won't even get into that, but it's usually like about 2 weeks or so. And then the rapid tests are, pretty good, but there are, potentials for like false positives there and false negatives. The best test is a 4th-generation test where you're going, and it's not just a mouth swab for the HIV, it's a 4th-generation test where you're getting antigen and antibodies, which it's too much to really get into. Test it so you know, one, that you don't have an actual viral load in an acute viral syndrome, and two, you have not formulated antibodies for HIV. So that's the ideal test. However, any testing is better than no testing. So if you need to do the rapid swab test on a van somewhere because you only have 15 minutes and you just need an idea, it's better than nothing. And any proper counselor is going to tell you the limitations of that and send you on your way.
Okay, so there is, I'm pointing to a van service, Charmaine, in front of you right here. If you can pass that right there. Yeah, if you can give it to me for a moment, please. Thank you. So you can have STI, HIV testing. You can go to Baltimore City Health Department to get free, no cost to you. We charge the health insurance, and if you don't have insurance, no problem. The most important thing is getting tested, and they will accommodate you. And prep, you're supposed to also get prep for free. But sometimes your insurance might want to charge you, and that is something that actually you should be reporting. But right, as far as I know, the pharmaceutical company has made arrangement with insurance companies in the interest of promoting HIV prevention to cover PrEP. So if you have any challenges, please reach out to the PrEP navigator right here with any question, and we'll be giving out her information. There's also free mobile healthcare providers that have scheduled regular screening time every single day, and hopefully you can see it here close up, but we will also post it. Okay, so now let's open up for Q&A. Who has a question? Yes, and please speak loud and introduce yourself. Say a little bit about yourself. Not a whole story. Okay.
Hi, I'm Natasha. I'm here with Coach D, my auntie. We do a lot in the community. So, is with the prep test, is the actual infection injected into with those taking those pills and things like that?
Yeah. Good question. I hear this a lot, especially when it comes to like confusion around like the flu vaccine, because there's the strain of the flu within the flu vaccine, and people think that's how it is. There's no HIV infection or virus in the actual injectable or the oral regimen. This is just a tool that like protects your immune system from being able to like uptake, like if you were exposed to the infection, it's like a protection. So it's not the same as like a flu vaccine, and COVID also didn't have like that same thing, but there's a lot of confusion around that. But it's completely safe. It's not exposing you to any virus that you wouldn't have been exposed to begin with.
Great. Thank you. Question. Comments, questions? Yeah, don't be shy. Yes. Okay. Yes, and then sure. Yeah. Please just say.
Hi everyone, I'm Nabria, and I wanted to ask, what is the difference between PrEP and PEP? Because I've heard of PrEP before, but this is my first time hearing about PEP.
Okay, so PrEP is before any encounter around sexual health with a partner. So you take PrEP to reduce your chances of HIV infection. And you continue to use PrEPs to prevent any risk of HIV. So if you're in a relationship or not in a relationship and you periodically are exposing yourself to sexual activities, you continue to use PrEP, whether the daily medicine or the injectables twice a year. PEP is after you've had a sexual encounter with someone, and you do not know the status of that someone. Okay, so it could be someone that you met and you decided to have sex. It could be something you exposed yourself while you were out and maybe drunk and then got yourself in that situation, or in rape cases. So it's really after a potential HIV exposure. Then within the 72 hours, you take PEP. You just go and see a healthcare provider to be on PEP, and you'll be on PEP for about 28 days. Okay, so PrEP is before the encounter, PEP is after the encounter.
Wow, excuse me. Wow, that's interesting. I've never heard of that before. That's cool. That's pretty cool.
And that's why we're here. Yeah, that's pretty cool. Exactly. Okay. We have Sharmi.
So my question would be today, can PrEP be taken while you're pregnant? Is it effective while you're pregnant? And is it readily available if you wanted it?
Yeah. Yes, it's safe during pregnancy, safe with breastfeeding, readily available, subjective. As far as, providers are a huge problem, a barrier to care. It should be readily available, like was mentioned. The pharmaceutical companies have given drug assistance programs to help lower the cost, so it could be free for the most part. They've covered deductibles to really make it accessible. The barriers are knowing about it, getting your provider to get on board without the judgment and the stigma and the nice nasty, and those type of things, which are system failures and not necessarily about the availability and the readily availability of the medication.
So lastly,
If I could just add to that comment, and the piece about, you're really advocating for yourself with a healthcare provider is very important. If you look at our recent PrEP newsletter, two of the people that were interviewed said their healthcare provider did not know. One did not know about it, so they were learning about it together. The other one was making a value judgment about being on PrEP. So you have to be your own best advocate about PrEP, learn about it, and demand it or ask it from a healthcare provider who might say you really do not need it. But that's what we're here for.
so lastly, when it comes to like our youth, a lot of them don't want to go to the doctor or have their parents know or whatever. So they go to Planned Parenthood or somewhere where there's services for them. Would they be able to provide that for them there, as well as give them the information that's needed? Or like, is it something that they do, that you guys have an understanding of them offering it?
Yeah.
Yeah.
Yeah, Planned Parenthood is well equipped to prescribe PrEP. They're PrEP champions, from my understanding, so they should have no issues. And then to piggyback off what was mentioned about the providers, it's okay to leave your providers alone too. If they're not meeting your needs, I know that's easier said than done. It's okay to move around. It speaks more about them that you need to do that. I believe, yes, we need to be able to advocate for ourselves. I understand also that wears you down, and you don't need to be engaging in a service that you're paying for to be fighting. So move around as well. Like it should not be a hustle to get what you need.
All right, so
You can also log into www.preplocator.org for information.
So I said that was my last question, but then maybe think of another question. What is the age range for when they can start taking it? Like, how old would they have to be? Because children have sex way younger than we assume they do. So can you give it to young people without, there's the issue of, as an adult, I can make that decision. But if you have a child that is having sex, can you make that decision for them as a parent?
Legally, there are age restrictions. Like, for example, if you're below the age of 13, for example, you cannot do HIV STI screening or provide reproductive services. So I'm gonna let you elaborate on that.
I don't see pediatrics, but for 13 and above, and I believe 75 pounds, I can't remember the pounds exactly for the guidelines, but there's a weight component to the age, but it's 13 and above that they can most definitely be on PrEP and the age, the weight consideration.
Yeah, not under 13. Yeah. Yes, Wesley. Yeah, okay. We got a gentleman ask a question. Okay, gents, get ready.
Wesley Hawkins. So my question is, just I guess for clarity, when you say available, so women can go to their doctor and get birth control. Is it something where so you go to your primary care and ask for a prescription to have the prep before, and then it's certain like CVS's or pharmacies you can go to get Plan Bs. So when we saying this is something that the community can um, get to in some type of way, depending on your doctor, is it like they go into their primary care to ask for a monthly prescription, or every 6 month prescription, a yearly prescription? How does it work in those terms of actually getting the prescription?
So yes, the point of entry, as she was saying before, it can be your primary care provider, but it also can be some of the other sites that we talked about before. And once you start, it's prescribed based on, again, your potential exposure. So it's, I think, first 28 days, correct?
For
For
PrEP,
for PEP,
yeah.
yeah,
For
for
PrEP,
PrEP,
it depends on the provider, but it's monthly.
yeah.
OBGYN actually introduced me to that.
Okay, so
OBGYN.
to PEP, right? Yeah, so so like, as you said, alluded to, which is Plan B. So PEP is post-exposure or potential post-exposure. So that's a little bit different than PrEP, but yes. So the point of entry can be wherever you seek for your medical intervention, right? Or your health intervention. So it could be your primary, it could be your OB, it could be the Baltimore City Health Department. But wherever you go, the healthcare provider can prescribe that medication for you. And for the length of time,
Yeah.
for the PrEP monthly.
Yeah, I was gonna say also, any licensed provider who can prescribe medication can prescribe PrEP. It's an issue of comfort, it's an issue of bias, it's a systems issue, which is why I say like you might need to move around. But any provider can. If you go to the emergency room, you should be able to get PEP, especially because you only have that 72-hour window. I know Hopkins emergency room is doing better in being able to screen and prescribe PEP, which is post-exposure if necessary. And how long, it's not over the counter, like you were saying about Plan B. You have to have a prescription to get it. And as far as like the different touch points, it just really depends. And how long your prescription is also really dependent on the provider. Where I may be comfortable prescribing for 3 months and see you in 3 months for your labs and repeat, someone might need to see you more frequently. So it's really provider dependent. And that's where like conversations and like shared decision making comes in.
So the last point, you kind of just answered my second follow-up question, because as being a man, men don't really take medication when it's determining when you talk about sex and things like that. But a lot of women are used to taking pills like not Plan Bs, but birth control and things like that. But it's like they have a schedule with that. So if I'm teaching this to the young men in the community, how am I properly introducing that to them? Is it something that, is a pill they take weekly? Is it a pill monthly? But you kind of said it could be up to the doctor.
No, it's a daily pill. You take it
Okay.
every day. There are, and I don't really like to teach this broadly, it's prescribed daily to take daily. Is there wiggle room if you forget your medication one day? Don't double up. It's not the end of the world. However, it is prescribed daily to take. And as far as like education, getting men more like involved in taking PrEP as something they find useful and not putting it onto like a woman to do it. It's something for you, and you shouldn't necessarily be looking to say, oh, someone else got this. I'm just at the mercies of this other person. And if it's a reminder thing, I tell people just put it near your toothbrush right before you brush your teeth, take your pill. If you can't remember to take pills, there's an injectable where you get it every 2 months. So it's out of sight, out of mind. So there's different ways around that.
Yeah.
I got one more last piece. So the reason why, I asked those questions as far as a standpoint of a man is because if you're going to be real in a space like this, a lot of men don't like to use condoms because they feel like it take away from the feeling. So that information need to be put out there that is almost like a preventative thing that can help you, but it also have to be taught in a way that people can feel comfortable. Because, in spaces like this, I think it's good to be honest and real. Because I know, the work that I do when I'm dealing with a lot of young men and young ladies, people treating HIV, and STDs and AIDS and things like that almost like, oh, is that still around? People still get that? So if you got people responding that way, they almost responding like, almost like it was chickenpox, like it kind of went away a little bit, not knowing that the rates are going higher.
Thank you. I mean, the questions are really, really important. It should be a shared responsibility. It shouldn't be left to your partner. If you're gonna have sex, then you've taken a step on your sexual health. And so what statement, how you want to protect yourself is really up to you. You can't just afford to leave it up to your partner. So the responsibility is on you, and there are great options for you. Then the piece about condoms, you very important point. What men say, it doesn't feel good on it. It would not feel good if you get an STI either. The burning, the itching, all kinds of issues, the treatment. So you have to think of it like that, and just give them the reality. Once they get used to it, I think that they will stick with it. But it will take time. It's a cultural shift to have men take responsibility for using condom. And then it's also the partner's responsibility to really push condom for just the sexual experience would be better if you do not have the worry of having HIV and STI, getting HIV and STI.
Yeah.
And then
And some of this stuff too is like, we need to have honest conversations. Like you were saying, this whole notion of like condoms don't feel good. There's hundreds of different condoms out there. There's thin, there's lambskin, it's just a matter of finding what works for you. The whole condoms don't fit. I've literally put my whole arm in a condom before. I've seen thousands of penises in my lifetime, and I have yet to see one that won't fit into a condom. So it's a matter of having some reality checks too. I think some people are disillusioned, and I think these conversations maybe in a clinic setting need to be situated within reality, where we're having some real conversations, and I think that could help address some of the delusion, like they say, I think that's what's going on here. And I tell people to really reimagine, like, safe sex is sexy. If you're not concerned about, oh my God, I'm gonna have to be in the clinic in 2 weeks, you might be willing to go the distance and have some fun. So I'll leave that there.
A few points that I wanted to add in. Some of them I'm actually forgetting, and that is one, you can make condoms part of your foreplay, and just use your imagination. You can do the chicking, just put a condom in your shit and put it down.
Okay, Mark.
But also putting a drop inside a condom, lubricant drop, and then creates a sensation for a man. So there are so many things that you can add to your sexual experience with a condom that can enhance the experience. So it's a matter of learning. Maybe that's another session that we might say. You move on. Yeah, that's another
to next month's session.
Curtis.
So I keep hearing that there are folks that had HIV, but they're undetectable. Can you kind of go into details in terms of engaging with the person that says, hey, I have HIV, but it's undetectable, I'm good? Can you explain to us what that blood count, or what some of the particulars, help us out?
Yeah, the viral.
Okay. So this was just on social media yesterday. I got like a whole bunch of messages because there was something going on in a community where some man potentially transmitted 20 different women with HIV, and now he's alleged to be undetectable. So people are saying, what does that mean? Is it real? What's going on? So the science says if you're undetectable, which means you're on medication, you're on antiretrovirals, so your body has suppressed the virus to where it's not detectable within labs. That does not mean you are cured, because if you stop taking your medication, you have an increase in viral load. So it's just saying your immune system's working enough to have suppressed the viral load. And because your viral load is so small that it's barely detectable by labs, you're not able to transmit the virus. So we call it U equals U. So undetectable is untransmissible. So you need an adequate viral load in order to transmit. And as long as you're on your medication, which is why that's an important message to have, prevention is also people taking their medications. Because if they're on their medication, they can't transmit, even if they're having unprotected sex, because they have such a low viral load. Now, some people say, they don't necessarily trust that. So partners who are in what we call serodiscordant couples, so one person's living with HIV, another person's negative, if there's anxieties around, hey, I don't know if this person's going to take their medication. Occasionally they go through bouts of depression and they end up not taking their medication, or they're on substances and it's unreliable. You can be on PrEP if you need that extra reassurance. However, if your partner is consistent, they've been undetectable for a period of greater than 6 months, there's no other reason to believe otherwise. There's no reason that they should be able to transmit. It's a 0% chance. And we rarely say 0% anything, but if you don't have a viral load, there's not a way to transmit the infection.
All right, wonderful, what a beautiful crowd, with great questions, and we have run out of time. So let's hear it for our guest, Delina. And all of you, thank you so much for a wonderful experience. Please continue to follow us. We have monthly meetings, and we're going to be setting up. We have LinkedIn page that Jimmy manages and distributes information about our work. We're going to have really dedicated space on our website that will have information about all of our work promoting HIV, AIDS prevention, and sexual health. And if you want to get on our email list, please contact Jimmy right there, Jimmy, and he will add you to an email list. Okay. All right. Thank you.